Hello, my name is Petrescu Corina and I am from Romania, and together with my colleagues I assessed the effects of COVID-19 pandemic on the evolution and efficiency of health expenditure in Eastern European countries. Regarding the research problem of this paper, it refers to the global context of the COVID-19 pandemic when economic and social systems were shaken to their foundations, in the sense that many businesses had to close or suspend their activities, which also had a negative impact on the quality of life of the population, both from a medical and economic perspective. Thus, like other countries around the world, Eastern European countries that are members of EU community have also faced such economic and health problems. In view of these issues, the purpose of this paper is to identify and analyze the evolution of health budget expenditures allocated to the management of the COVID-19 crisis in Eastern European countries and the efficiency of the allocation of these costs. Regarding the objectives of this paper, this will be approached in detail in the following. The first objective refers to the analysis of the dynamics of the share of health expenditure in national GDP allocated to the pandemic management in EU members countries like Bulgaria, Hungary, Poland, Romania, and Slovakia. In order to accomplish this objective, the trends of the following indicators were analyzed: health expenditure in GDP, hospital services expenditure in GDP, and medical products and equipment expenditure in GDP, being also made a projection for future years. Regarding the research methodology of the first objective, it refers to the selected analysis period for the 2016 and 2021 in order to identify the impact of the COVID-19 crisis on the trend and behavior of public health expenditures in GDP. Also, the data needed for the analysis was selected from the website Eurostat.eu and was processed using SPSS version 26 in order to obtain the graphics of the trends in accordance with the method of cubic time series of the following form. Therefore, while some trend graphics were created for three indicators. The first one is for the health expenditure in GDP. And according to the presented graphic, we can see that in the analyzed period, it presents an upward trend, especially since 2020, when the COVID-19 pandemic struck and it needed an urgent response from the governments regarding the expenditures needed to manage this crisis situation. For the future years, it is projected a rising trend too, even though the COVID-19 pandemic has ended. This could be attributed to the fact that, generally, countries realize more the importance of an effective, modern and equipped health system, giving them the fundamentals to increase the investments in this domain so that they could be more prepared for situations like this in the future. The second trend graphic is for the hospital services expenditures in GDP indicator. And according to the presented graphic, we can see a general downward trend, but with an increase in 2020 and 2021, when the COVID-19 pandemic determined more hospital admissions that supposed more expenses for the care of the patients in an overloaded health system. For the future years, it is projected a decreasing trend, considering that the health system in the analyzed countries is not overburdened anymore with patients far beyond their real operating capacity, because the COVID-19 pandemic is over and another outbreak is not expected, meaning that there will be no need for excess expenditure with hospital services. The third trend graphic refers to the medical products and equipment expenditures in GDP, and it presents a general upward trend, especially since 2020, when the manifestation of the COVID-19 pandemic has led to significant acquisitions of sanitary and protective equipment in order to manage the spread of the virus in the medical units, and also in order to cope with the high flow of patients that needed care in this period. For the future years, it is projected an upward trend too, considering the intentions of governments to invest more in their health systems, and also the fact that now, in almost all medical units, exists a much more preventive approach in the Medical Care Act, determining this way a higher level of expenses regarding the medical products and equipment needed in their activity. The second object refers to the quantification of health expenditure efficiency indicators with impact on deaths reported as caused by COVID-19, tests performed, vaccination rate, number of total COVID-19 cases, and number of recovered people. In order to quantify the efficiency of health expenditure, the indicator people recovered has been established as the dependent variable, and the following indicators have been established as independent variables: health expenditure in GDP, hospital services expenditure in GDP, medical products and equipment expenditure in GDP, COVID-19 tests performed on 1,000 people, vaccination rate, total COVID-19 cases, and total COVID-19 deaths. Regarding the research methodology for this objective, this refers to the following aspects. The selected analysis period is 2020 and 2021 because the data regarding the COVID-19 issue is only available for these 2 years, and the main purpose of this paper is to analyze the efficiency of health expenditure in this period of the pandemic. The data needed for the analysis was selected mainly from the website ourworldindata.org and other public official websites that was processed using SPSS version 26 in order to obtain the efficiency index of the health expenditures expressed in the level of recovery of patients after being infected with COVID-19 virus. 2 models were generated, one having the health expenditure on GDP indicator as independent variable, looking from a general perspective, and one having the hospital services expenditure and the medical products and equipment expenditure in GDP indicators as independent variables as components of the first one. Here we can see the first econometric model, which considers the indicators vaccination rate, total cases, COVID deaths, tests performed on 1,000 people, and health expenditures in GDP. As a result of the calculated regression coefficients in the SPSS software, the proposed model is presented in the bottom of the slide. We can also see that the histogram here presents a normal distribution, which confirms the authenticity of the model. Here we can observe the second model, econometric model, which considers the vaccination rate, the total cases, the COVID deaths, the tests performed on 1,000 people, the medical products and equipment expenditure in GDP, and the hospital services expenditures in GDP. And we can also observe the regression equation after the calculated regression coefficients in SPSS software, and also the histogram presented on the slide presents normal distribution, which confirms the authenticity of the model. In this table we can see the regression coefficients and the positive or negative correlation of the dependent variable with the independent variables. Regarding the correlation with the vaccination rate or with the number of people recovered, it is a positive one, meaning that as the number of vaccinated people increases, so does the percentage of those cured. Vaccination campaigns and expenses made for this purpose, contributing therefore to a better and more effective management of the health crisis. Thus, regarding the correlation of the test performed with the number of people recovered, it can be seen a positive one in the both calculated models, meaning that as the number of COVID tests is increasing, so does the value of the indicator representing the percentage of recovered people. This can be explained by the fact that the COVID testing was used as an important tool for managing the spread of the virus, and our results suggest that the expenditures made in this direction were contributing to increasing the efficiency of the policies adopted for the management of the COVID-19 crisis. Regarding the regression of the expenditures with health, hospital services, and medical products and equipment in GDP with the number of people recovered, it can be observed that in the first calculated model, uh, there is as independent variable the health expenditure on GDP, and in the second one, this one is replaced with its components that were selected for this analysis, namely the hospital services and the medical products and equipment expenditures. In both of the cases, we can see that all these three indicators have a positive correlation with the recovered people indicator, meaning that as the level of these expenditures increases, so does the number of recovered people, a high level of health expenditure determining a high level of recovered people rate. Also, regarding the correlation of the total COVID-19 cases and total COVID-19 deaths with the number of people recovered, we can observe that there is a negative correlation with the percentage of recovered people in both of the calculated models, meaning that as the value of the reported cases and the reported COVID deaths is decreasing, the more the value of recovered people is increasing. This can be simply explained by the fact that when the value of active cases of COVID-19 is decreasing, those values are going either to the reported deaths indicator, either to the recovered people indicator. And when the value of COVID deaths is constant or is decreasing, the value of the recovered people is increasing. The third objective refers to the performing of a bibliometric analysis of the literature in the field of interest using the SiteSpace software in order to compare and highlight the importance of other results already obtained in the field. This objective will be approached with a meta-analysis of the literature on the subject of interest, with highlighting the most important and relevant results in the literature regarding the role of health expenditure levels in mediating the number of death cases and recoveries, and on other indicators also. The contribution of different factors in determining the level of public health investments and their fluctuation in the context of COVID-19 pandemic struck. This objective will be approached in more detail in the final paper. Regarding the results obtained, we can say that the purpose of the research has been achieved, namely the evolution and the trend of different categories of health expenditure have been analyzed, and their efficiency in the period of COVID-19 crisis has been identified. The health, hospital services, and medical products and equipment expenditures present an upward trend beginning with 2020, when the COVID-19 pandemic struck in Eastern European countries and in the rest of the world, meaning that the analyzed countries increased their attention and their budget on managing these crisis situations. Regarding the efficiency of public health expenditures in the period of 2020 and 2021, expressed in the number of people that recovered after being infected, the obtained results show that an increase in their level leads to an increase in the number of recovered cases. Regarding the research limitations of the paper, this refers to the small number of countries that make the sample data and also the short period of analysis for measuring the health expenditure efficiency. Regarding the future directions for this paper, this could refer to a comparative analysis between Eastern and Western European countries regarding their capacity to allocate a certain level of expenses to the health domain and their level of efficiency expressed in the rate of recovered people. Thank you so much for your attention.